Okay, so the skeleton. I would greatly encourage you to play, if you have Adobe Acrobat on your computer, play Whack-A-Bone, because it will help you learn the parts of the skeleton. There are other games out there too, and if I find some other ones I like, I'll load those for you to play just to practice. Now, the skeleton, if I'm going to go through the entire skeleton, but you're going to have to identify individual bones on the test. And for human bio, all you have to do is name that bone. You don't have to name the parts. You get to A&P1, you have to know parts like condyles and malleoluses and foramens and stuff, but not for your class. So I'll go through the parts of the skull. This whole thing is the skull. You have the facial bones and you have the cranial bones. You have a little bone here that your tongue muscles are attached to. It looks like a horseshoe, and that's called the hyoid bone. It's the only bone that doesn't articulate with any other bone. I'll go through the vertebrae. You need to know the different parts and be able to identify the different vertebrae. If we're looking at what we call the axioskeleton, that includes your skull, that includes your vertebrae, okay? And it also includes your sternum here and your ribs, okay? And that's, if you look at a skeleton, they always organize it according to different colors, and it's in your notes that way too. The appendicular skeleton are your girdles, which includes your clavicle and your, back here, your scapula. They're holding up your arm bones, which are your humerus, your upper arm bone. On your thumb side, it's your radius that allows you to turn your wrist, your ulna. There are 8 what we call carpal bones or wrist bones. A&P1, you learn the different names. The palm of your hand contains 5 metacarpals. And then, of course, you have 14 phalanges, 2 in your thumb, 3 phalange bones in each of your other fingers. The pelvic girdle includes your hip bones here, which are often, well, you won't have to know the individual names. They're called the coaxial bones, all 3 of them collectively. And then they support your femur bone, which is your lower leg bone, your largest, strongest, longest bone in the body. And your 2 lower leg bones, you have the tibia that supports your body weight. The fibula supports no body weight. You can break it and still walk. It's going to hurt, but you'll still be able to stand. But it's there for muscle attachment and balance. And then you have 7 tarsal bones. Those are your ankle bones. Your 5 foot bones, which are metatarsals. And then again, 14 phalanges. 2 in your big toe and 3 in the other toes. The big bone here, I always have people learn that one. That's your calcaneus. Takes a lot of pressure. And then the bone that articulates with the tibia is called the talus bone. I also want you to learn the top 2 bones of the vertebrae. This is the atlas that holds up the head. And then the cervical vertebrae number 2 is the axis, and we'll go through that. Now, these should look like different animals. The cervical vertebrae, they say, look like an elephant. The thoracic vertebrae, there are 12 of them. They should look like a giraffe with a long nose here. And then you get the big rounded nose here in the lumbar. That's a moose. Okay? And then you have the sacral region, which are 5 fuse bones, and the coccyx region. And we'll go through that. So there's a saying about how you eat. Breakfast at 7, there's 7 cervical vertebrae. Lunch at noon, there's 12 thoracic vertebrae. And dinner at 5, there are 5 lumbar vertebrae. Okay. And I forgot your patella. Your patella is a sesamoid bone, meaning it forms out of a tendon, and that's what we call your kneecap. You're not born with it. It has to develop as you crawl. All right, so let's go parts of the skull. You're not going to have to know all the bones of the skull, but some of the major ones. And again, they're in your notes. Forehead here is your frontal bone. And you learn these because you have to know the parts of the brain that correspond. You have two parietal bones. See, they're divided by a suture here. And these sutures up here are named for the planes of the body. So this is your frontal or coronal suture. This is your sagittal suture, divides into a right and left. This is your occipital bone back here. The temporal bone is above the ear. I never like how it shows up in this. Maybe a little better, and not so much. Temporal bone is right over the ear here. It's got all kinds of processes off of it. You can see there's a process coming off, forms your cheekbone here. And then your sphenoid bone is right here. It's where for our temples. As far as facial bones, you have to know your maxilla, which is a pretty big bone here. Upper jaw. The lower jaw, of course, is your mandible. It's the only movable bone. Then you've got your nasal bone, only bone of your nose. Going back from the nasal bone goes nasal, maxilla, lacrimal. You'll see a little duct there. That's where your tears drain in the lacrimal bone. And the inside here of your eye socket is your ethmoid bone. And your cheekbone is called the zygomatic bone. So those are the bones of the skull. Now, sitting down underneath the skull is this little bone here. It looks like a horseshoe. And it sits right down in here for your tongue muscles to attach to. Okay, when people get strangled to death, usually they can tell because this bone breaks. It's crushed. I had one student whose bone was backwards. When we were studying bones, he lifted up his neck and he had these two protrusions here, right here and here. He asked me what they were and I said, I don't know. So I called his mom. I said, you might want to ask the doctor. Doctor looked. Next time he went in, doctor said he didn't know. So they took an x-ray and this kid's hyoid bone was backwards. But all the tongue muscles were attached, so it was fine. So you can have things wrong in your body and not know it, and they might not cause any problems either. All right, so as far as individual bones, let's look at the vertebrae first. You have to know your top two vertebrae. This flat one here holds the skull up. In fact, there's little occipital condyles here that this bone sits right in, and that's called your atlas. The next bone underneath it that fits into the atlas, you'll see this little protrusion here, and that protrusion fits up inside of there, and that is called your axis. So what happens is that your atlas allows you to say yes, and your axis allows you to shake your head no, pivots your head. Those are C1 and C2, your first two cervical vertebrae. I said that your thoracic vertebrae look like a giraffe. You can see the long nose. You can see the cute little ears and horns. I think it looks like a giraffe. Those are thoracic vertebrae. The big ones down here, well, here's an elephant. This isn't a very good one. It's a little better. An elephant, these are your cervical vertebrae. A lot of times it looks like they're split like an elephant's trunk. You got the elephant ears here. And then the moose, big vertebrae. This is the body of the vertebrae, the big nose here. See the cute ears and horns. This is a moose. That's your thoracic or your lumbar vertebrae. You see this hole here? That's where your spinal cord goes through. When people have disc problems, it's here, the body of the vertebrae. And you have cartilage discs there that wear down over time. And then if they're gone, then that can move, and you can pinch the nerves in that vertebral foramen here. Largest bone of the body, longest, strongest bone is your femur. You can always tell it's a femur because the head of the femur goes to the side. If we look at the head of the humerus, you can see that rounded area is pretty much, it goes a little to the side, but not as much. That femur bone has to fit in to a depression here. You don't have to know that fancy name, the acetabulum. It has to fit right in there, of course, to give you stability to support your body weight as we stand upright. And of course it's rounded, so you can have a nice multi-axial ball and socket joint that can have a lot of movement. The humerus just kind of hangs. That's why you can dislocate your arm much easier than your femur bone, because this one's just hanging and it's just held there by a bunch of tendons and ligaments. So if we're looking at the femur bone sits on top of the tibia. And you can see the tibia is flattened here to support that weight. So there we have the tibia. You can see the little protrusion here where the patellar ligament comes down. And you should see this little hook here. This is what we commonly call the ankle. We can feel that little bump in the inside of our ankle. That is the medial malleolus of the tibia. I want to ask you that. So that's how it sits. And then next to it, hanging on, is the fibula. So the fibula just kind of like hangs on the end here. And again, there's a protrusion there, and that protrusion is the outside bump on your ankle. And the fibula, you can see, just kind of forms more of a rounded area for your lower leg. So here's your humerus, and then your humerus articulates with your ulna. See that little, it's called I call it the U for ulna. That's your elbow that you feel. Hooks right in there. Nice hinge joint. And you can see that the radius then, see how it's rounded, nice and flat, so that radius can rotate. And that's exactly what it does here. It allows for rotation. And that's on your thumb side. So in an anatomical position, if you remember, your hands should be forward, your palms, so that the radius is your lateral bone. Your ulna is your medial bone of your lower arm. If we look at the hand, again, 2 rows of carpal bones, wrist bones, there's 8 of them. These are your metacarpals, and these are your phalanges. That's all you need to know. In the foot, here's your big calcaneus, there's your big talus. You can see that your tibia just fits right on top of that talus. You have 7, and they're larger than your wrist bones, of course, for body weight. 7 tarsal bones, 5 metatarsals, and again, 14 phalanges. To hold up your upper arm, you've got this little bone here. You can see the flattened end. The flattened end articulates with the scapula here. So this is in front. This is your clavicle, your collarbone, most commonly broken bone in the body, because we brace ourselves. And you can see your scapula. Sometimes you can feel that spine of the scapula. And you see that rounded area there, that the head of the humerus, it's called the glenoid cavity, so it fits right in there. And then again, this is your hip. There's a big hole here because that's where your sciatic nerve goes through, femoral artery. Again, big depression here for the head of the femur, and we call those the coaxial bones, all 3 of them collectively. This is your sacrum. You can see it's fused, so nice and strong, hard to break. And here's your coccygeal tailbone. You're born with anywhere from 3 to 6 of these bones. They fuse. There are people born with a tail, they just cut it off. Doesn't wag. And you've got a lot of holes here, and the holes there are for nerves and blood vessels. And then of course we have, this is a rib bone. You see how it's curved. You have 12 pairs of ribs, 10 of them in front. I don't get too excited about false and floating. 10 of them articulate directly with the sternum here. And then the last 2 pairs of ribs are called the floating ribs, and they're in back, and they articulate with the T11 and T12, the thoracic vertebrae. And of course this bone here with this cartilage attached, this is your sternum. Most of your heart lays underneath it for protection, not all of it. This is what they have to crack open for heart surgery. And there, this again is your mandible. So those are your bones. You'll need, again, what in the test, there'll be one of these, and you have to identify it. And you want to look for landmarks, like I know this is a humerus because of that rounded end. I know it's not a femur because it's not going to the side. So that's the way you should study these bones. So those are your bones you need to know.